so that you can really get into those lines and you can stimulate that collagen and elastin effect once the healing cascade happens. Stay watching to the end of the video where I'll explain what the healing cascade is. In my opinion, the DermaStamp was definitely an exfoliating action as well. The next day my skin was very soft, really radiant, and I mean it was amazing, but over time it's going to look even better. So even though you do get an immediate effect, I'm really going to see better skin, more plump in areas, and those fine lines reduced in that 4 to 6 week mark.
Wow. Whoa.
So this is the part that most people would probably find a little bit disturbing. This is called Petechiae. This is normal. There will be little bits of blood that happen when you have derma rolling and derma stamping done. In particular, when the saline solution is used, it just wipes away. So this isn't vessels or deep enough for gushing blood to happen, but it does happen and it's okay. And this is why it's so important that we use, everything's sterile. The gloves are sterile, nothing's touched after the gloves are put on. You'll see later on in the video that the therapist also changed her gloves to put on more topical treatment after it's done. Your skin can remain open from all that micro needling and micro stamping up to 40 minutes after, so you do have to be really careful with not touching your skin for at least that hour afterwards. But it looks scarier than what it is.
I think too with the roller you can't really get in like here.
No.
Like you can with this. I think that's the advantage.
Yeah, that's really good. Fits better in places.
Yeah. I mean, I think probably both have their advantages and disadvantages. Derma Roller, though, this company, they do rollers.
Yeah.
They do sell rollers.
Yeah.
So it's not that I think it's Derma Pen that's against rolling.
Right.
So again, concentrating on the nasal labial, on the crow's feet, on the frown lines, and any lines on my forehead. Out of the whole treatment, I think this is the only part that I thought, oh, this is, it's so thin skin under my eyes, is it going to be okay? But because the settings were tuned down and the size of the needle was tuned down, and right under the eye near the orbital bone, there's no stamping literally done, no pressure, it felt okay. So at this point you can pretty much feel like you're a burns victim. I mean, in all seriousness, when I picked up the mirror and looked, I was like, whoa, that's so red. You can't feel the effects of it, you're so numb anyway, but you are really red, and it could be a shock to you to see your face like that. It really truly does take a couple of hours to calm down, and you're fine, but you would need coverage if you were leaving and going somewhere public. I think most people would probably do this and go home, to be honest. It's, like I say, it's a little bit shocking to see your face like that, but it's really exciting as well because you're seeing something happen. You're seeing your skin respond. It's not so happy, sure, but it's not going to last like that forever, but you see the results of something being done to your skin, and I find that really exciting myself. I think that's really cool. Right after the area has finished being DermaStamped, then saline solution and gauze pads are used to wash off any of the solution or any of the petechiae that's on the skin. Then a special mask gets applied. After 15 minutes of having the mask on, the mask is taken off and the remaining serum is massaged into my skin.
So you leave that on for 10
Well,
to 15.
I just felt like, like it wasn't cooling. It's not like an alginate.
No.
It was more like it was like the warmth of my skin was then kind of being pushed back into my skin.
Because there is all these little micro channels that are open on my skin at the moment, there's this awesome serum that's in the mask, or even if it's put on topically, it's all absorbed up to 80% more efficiently and effectively. So this is the exciting part. This is where things get to go deeper and have more powerful effects. Now an antioxidant soothing serum is being put on after the mask has come off. After all the serums have gone on, it's absolutely imperative that a sunscreen / moisturiser is put on my skin. You must put something with an SPF in it or natural sunscreens in it, because your skin is just had a whole lot of exfoliation and a pretty invasive treatment done, so you need to protect it. This isn't just for the day that you have the treatment, this is for afterwards as well. This is for always really, you always need SPF. The number one reason of aging for your skin on your face is because of UV rays. If you look at the skin on your face and then look at the skin on your stomach, there's a huge difference, and that is because your skin on your face is constantly being bombarded by UV rays. So SPF is really important, whether you have a tinted moisturizer, even if you have full-blown SPF 30 or 40 in your foundations, you must be wearing SPF. Overall, I thought that this treatment, if I compared it to microneedling, was on par, if not maybe a little bit more soothing in the fact that it's a smaller device, it vibrates, and it can be changed from 0.5 millimeter to 1.5 millimeter at like a turn of a pen, and I just think that, you know, that's quite cool. I'd have to use 3 different rollers if I was doing that on someone. So I thought it was pretty impressive. The DermaStamp, as I know it, is only allowed to be purchased by doctors. I would definitely go for the DermaStamp again. There is no doubt that I thought it was worthwhile, and thanks for watching the video today. I hope that you learned something from it. If you want to know about the healing cascade that happens when you create the trauma on the skin by microneedling or microstamping, just watch the next couple of titles and that will explain to you exactly what it's all about. So your skin gets injured by the DermaStamp. Normally there's blood clotting and inflammation when you're injured. In this case you might have petechiae, you will have inflammation and slight swelling. The inflammatory phase is the body's natural response to injury. The phases of healing are inflammatory phase, proliferation phase, and maturation phase. Once homeostasis has been achieved, which means stopping bleeding, blood vessels then dilate to allow essential cells, antibodies, white blood cells, growth factors, enzymes, and nutrients to reach the wounded area. It's at this stage that the characteristic signs of inflammation can be seen. This can be seen in erythema, this is redness of the skin, heat, oedema, which is swelling, pain, and functional disturbance. Maturation is the final phase and occurs once the wound is closed. This phase incurs remodeling of collagen from type 3 to type 1. Cellular activity reduces and the number of blood vessels in the wounded area regress and decrease.